Good morning. It's been quite a morning.
That's right. We have Dr. Allison Pontius on today, facial plastic surgeon, and you, Duncan Turner, MD, talking about, I really wanted to do this episode on regenerative medicine and regenerative aesthetics because I think it's just trending so quickly and forwardly moving right now, and I wanted the both of you to really break it down.
Well, there's so many similar things between what's being done on the cosmetic side of things and what we are doing, and a few of us vagina doctors are concentrating on. And we're using the same sort of technology with, as I said in the podcast, that they're just a little bit further ahead of us.
Yeah.
But we're not far behind, and we're learning very quickly from what they're doing, and whether it's using stem cells or exosomes or platelet-rich plasma or PPF, microneedling. PRF.
Anyway, enjoy the episode.
But what do I know? I'm just a vagina doctor. So today, another podcast, the Vagina Doctor podcast. Allison Pontius, plastic surgeon, welcome.
Thank
you.
Great
to have you.
Thank
Obviously,
you.
as most of the people that will be listening to us know, that we work together a lot. And we wanted today to discuss the changes in regenerative medicine that I would say are probably the most expanding part of plastic surgery, cosmetic surgery changes these days due to science changes, basically.
It's really exciting. It's just applying those regenerative medicine strategies to aesthetics, really to help regenerate collagen and using more natural products that are very biocompatible and delivering great results. So it's an exciting time.
You know, it's sort of funny if we look back at this, because stem cells were first used like 50 years ago.
Yeah.
The veterinarians were always way ahead of us as physicians in what they were able to do. It seemed like racehorses were more precious than humans. And they used platelet-rich plasma, for instance, in terms of healing. It then came into medicine through the orthopedic specialists. Then transferred to cosmetics, and now we're seeing it in gynecology as well, which is sort of quite a journey of progress. And it's all scientifically based. It's all physiological, and it's really effective, more so than other things before. And it's been really exciting to be part of that.
Yeah. We've got a lot more options now, and the science backing it up is really supporting its use in dermatology. Really, we're trying to regenerate those aging tissues, collagen, the dermis, elastin, and using anything from stem cells. And usually these, adipose-derived stem cells, nanofat's really exciting. And I think that's at least my personal next frontier, is really looking into that and really just using those adipose-derived stem cells from your own body.
What is this? We have to explain this deep. More. Yeah. So nanofat.
Nanofat, it's not a traditional fat transfer like we've done in plastic surgery for years, where we're trying to just get volume in the face or in the body. This is really taking that fat from a little bit, like a little mini liposuction, emulsifying it, just kind of turning it more into like a filler consistency, a liquidy consistency. And there's no intact fat cells, so we're not volumizing with it, but it has cytokines, growth factors, the stem cells in a really concentrated fashion. And so injecting that has been really helpful. A lot of colleagues inject that during facelift surgery, for acne scars, for hair growth, to take advantage of the stem cells in addition to all those growth factors, peptides, cytokines that we can get from something like PRP. And that has been really exciting. It involves like a little bit of a procedure to harvest the fat, but it's still your own body. We're not getting it from a lab or from, any other source. So I think that has really huge potential.
Well, how is that different from a regular fat transfer?
So the cells, they're not intact fat cells, which we want when you want to like do a Brazilian butt lift, let's say, or volumize the face, where we want those fat cells to get a blood supply and grow and stay there. Really, the fat cells are kind of ruptured. You're kind of breaking it down and pushing it through almost like a sieve to emulsify it, to just break the fat down.
That's with the regular fat transfer? Or
no, that's with
the
nano fat. Yeah.
Okay.
Yeah. And there's just little cube-like devices, almost like, I don't know how you'd put Play-Doh through those things to make it look, to come out. And it just breaks it down and it gives it a nice thin consistency. So we're not volumizing. We're just getting the growth factors and stem cells from it. So that, I think, is really exciting and just shown to, improve collagen, elastin, the quality of the dermis, the dermal epidermal junction, hair follicle growth.
Is that all FDA approved right now? Or is that happening? Those procedures?
Yeah, it is. It is. It's happening. At our medical meetings, it's talked about quite commonly now. And because it's your own body, it's not under those regulations of like a stem cell that we would obtain from an outside source. So totally safe, totally fine. And really exciting.
Well, I know you're using a lot of the PRP, PRF in the office right now. And I know, Duncan, you're using a lot of PRP as well for sexual health procedures.
Right.
So I want to go into both those things, what exactly you guys are doing, but also I want to talk about why do you think everything is sort of shifted and moved in this regenerative direction and away from the traditional filler?
Well, I think it's what you're doing with the filler is you're putting a substance in there, whether it's the patient's own tissue, as in a fat transfer, as you would with a Brazilian butt lift, because you need a volume. You need a lot of tissue to do that. You don't need as much tissue when you're doing it in the face, but those are full cells and you hope that they're going to work. With the stem cells and the exosomes, which are stem cell derivatives, you're getting the ingredients of growth, because all rejuvenation procedures start with slight irritation of the tissue to begin a healing process, whether it's a facelift, a non-surgical facelift, or it's something we're using for vaginal rejuvenation. We're starting the healing process by causing a little bit of damage. CO2 laser was the first really to do that. And so when you've got that little bit of damage and this healing process starting with that patient, you're feeding sort of almost fertilizer into those cells being able to proliferate and grow. So instead of putting whole cells in there, you're getting the healing process going, and then you're feeding it fertilizer so it grows cells of its own.
Okay.
And that's how all of these procedures work. And it's been, I think a lot of the time, the damage that's done with those first things carries with it a recovery period. Whereas if you don't have to damage that as much, the recovery period is much quicker. So, and then you're getting, if you're using the patient's own tissue, there's that safety feature. Or you can use things like exosomes, which are stem cell derivatives, which don't carry the same risk as stem cells themselves because they don't proliferate. Stem cells can keep on growing and growing and growing. Well, exosomes give that all of the qualities of stem cells without that danger of proliferation. So it's just another direction that the science is going, improving safety and and improving results.
Okay. And Dr. Pontius, you've been using exosomes, you've been using PRP, use as a facial plastic surgeon, you're doing all of it in the office.
Yeah.
So you do a lot of filler as well. So I just feel like there's such a huge movement right now and shift towards these other modalities. And is it just because of safety, or do they work better? Are they proven to be better than a traditional filler? And I don't know if you can really say that, but
yeah, I mean, I think they do different things. If we want to contour the face, if we want to fill a wrinkle, an HA filler is probably still the best bet. PRF is filler-like, and when we do the what we call the easy gel PRF, by heating it and cooling it, we're making it into the consistency of a filler. And so there is a volume improvement with that. But really the PRF, the reason kind of going from PRP to PRF is just we're not taking out, so all the growth factors are sort of in a fibrin matrix. So they're held in a thicker consistency of the product to deliver those growth factors more gradually over time. So like in the, with hair restoration, so instead of like we used to just inject PRP and it would kind of give a blast of growth factors and then it's done. So you can get some kind of quick improvement, but it's not going to last over the long term. So you have to keep doing it. PRF will, maybe a little less dramatic from the get-go, but it's going to last months longer than PRP by delivering those growth factors over time. So that's, it's helpful. It gives people a longer lasting result. Or under the eyes, when we want to regenerate that delicate collagen, that delicate skin under the eye, the PRF, a layer of that, under the skin, within the skin, is going to deliver the growth factors over time and lead to longer lasting results. So I think they're all very helpful. And it just kind of depends what our goals are of which one to choose for that. But fillers, I think, will always offer benefit for an instant result, a noticeable change. And the hyaluronic acid is also sort of in the category of sort of these scaffolds that can improve the quality of the skin, like calcium hydroxyapatite, like PLLA, or like brand name Radius or Sculptra, which those are stimulating some collagen and elastin. And HA kind of has a benefit by holding water in it to improve the quality of the skin too. But really contour shaping and a quick, instant result that does last years is the advantage of a filler over like a PRF.
Quick question just about something she said, and I see it a lot on Instagram. With the PRF and the PRP, you wouldn't see those posts from plastic surgeons that are doing facelifts where they can see like the Sculptra, right?
Oh, no. So PRF and PRP won't. They don't create any fibrosis. And that's, the studies show that calcium hydroxyapatite and polyl-lactic acid do stimulate collagen and elastin, and we use them as sort of a biostimulator. But the question is
and that would be Sculptra and
Radius.
So everyone knows what we're talking about. Okay.
But is it good collagen, or is it just fibrosis and scar tissue like collagen? So it does create collagen type 3 and type 1 and elastin, but a lot of facelift surgeons are saying it's just sort of a layer of,
bumpiness,
what looks like almost a layer of scar tissue in there. And is that really helpful, or are we just doing it to make collagen, but that collagen isn't really the type of collagen that is regenerating tissues? So it's kind of a hot topic. Kind of certain doctors have opinions on it. But those products definitely do stimulate collagen and elastin as well. But if you are going to get a facelift in the next year, I usually tell patients to hold off on that and do something like PRF or an HA filler instead.
But we don't really know how long that lasts in the skin, right? Because
Not exactly. Like from the biostimulators.
Like when you were doing my temples the other day, you could feel on one side still something we did a really long time ago.
Yeah. You can feel it with the needle, just kind of the tension going through the tissues. And I know most plastic surgeons doing facelifts say, if you're going to do it within a year, avoid the biostimulators. But I don't know if that year is, just an antidotal type of thing. I would imagine it would last longer.
Okay. To answer your question previously was why are we using these new products? Is both safety and efficacy.
Yeah.
We believe they're better and they're also safer.
Yeah.
So
well, you're doing a lot of the P shot, and we get a lot of calls from men and wives of men just recently.
Yes, right. Yes.
Which is a funny story.
Wives wanting their partner to have a P shot.
Yes.
For those that don't know what a P shot is, it's a Priapus shot. It's an injection of platelet-rich plasma into the penis to diminish erectile dysfunction and maybe enhance the penis a little.
Yeah.
And it was really the first use of platelet-rich plasma in urological medicine. Mm-hmm. Other things have been used since, but there's another use for it in something called an O shot. And the P shot is an injection into the penis. O shot is designed to enhance orgasm. And
both using PRP.
Both using PRP, right.
Would you use PRF for that, for like a longer lasting, or has anyone just...
I don't know the answer to that. The times when it would be definitely useful to use PRF is in when we're trying to treat a labia majora issue, where there's loss of fat tissue in the labia, and that needs to be enhanced. So if we're trying to build that tissue up, that would be a better place that would be a very good place to be using the PRF. My personal interest has been more in terms of exosomes, but we've been hindered a little bit by the FDA.
Oh, it's all over. Yeah.
And it's still, there's still no FDA application for exosomes.
Everyone's afraid to say it.
And it doesn't really make any sense because you can use stem cells, but you can't use exosomes. But it's a matter of time.
Yeah, I agree.
And exosomes are much more easily accessible because you can have stem cell production lines from various types, either adipose tissue, as you mentioned, or from umbilical cord, which is the traditional way of doing it, and getting the exosomes, which are substances produced by stem cells. And they are not cellular, but they have all of these ingredients in them that aid healing. And that's why they're so valuable. And it does seem to me, a big change. I would say going from just injections of Botox and surgery when fillers started being used, 15 years ago, whatever, this is the next big step because we're avoiding some of the complications of fillers but still actually getting better results with these other things. Not that fillers aren't good and necessary and, as you said, sort of instant gratification. The long-term result is probably going to be in these physiological cell stimulators that...
How far out do you see that being, like exosomes being okay to inject? Because right now you can't, or it's illegal to.
But people are doing it.
Well, people are doing it, yeah. But it's at the meetings we go to every year. You have two groups of people. You have one group saying exosomes all the way, I inject, I do this, I do that. And you have another panel going, no. So it's confusing.
Yeah. I mean, there's the, certainly the people, they want to wait till there's, 10 randomized controlled clinical studies and, we know 100%. And then, others that want to kind of push the boundaries a little bit because they know they work and so they want to use them. But I think it's a little bit of the Wild West. There's a lot of companies sort of making exosomes. And I think we just need to kind of get a handle on it, have some regulations in place, have good screening for it, and then use it more widely. But we're still using it topically, post-laser, post-microneedling, and the healing process is amazing. PRP sometimes is a little inflammatory to use, and exosomes are very anti-inflammatory. So you can just see that redness going away more quickly. So I think for now, we'll use them in that capacity. And then, with time, be able to utilize them safely and effectively and really understand where they're coming from. And the companies are, in line with what the FDA is looking for. So I think they'll be here. Same with stem cells that are derived from other sources other than our own, that people go outside of the country to have injections. And so that I think is a time, we'll see,
So where are they able to do injections? Like out of the country? Everywhere but here? Is it like, where is it most prominent? Do we know the answer to that? Like, is Europe, are they on top of this more than we are?
I don't know. A lot of people go to South America, Central America, to clinics often run by U.S. doctors, there so they can do some of these things, legally there. But I mean, that's a lot for joint injections, spine injections, other areas too, not necessarily for aesthetics, but yeah, I'm not probably totally up to speed with where the regulations are on that. So we're trying to focus more on just our own body's products.
Yeah.
Because those are obviously fine to use in that person.
I know, like, for people doing vaginal rejuvenation, because I've talked to a lot of your patients, and I've never had exosomes after a vaginal rejuvenation treatment. But what I've noticed is your patients that have had a vaginal rejuvenation treatment without and with, once they have the exosomes, they never want to do it without the exosomes.
Yeah.
They just say it's night and day.
Yeah, we're
for recovery.
Really encouraging patients to do that as well.
Yeah.
That's a topical application.
Right.
After one of the procedures that we're doing, which could either be fractional CO2 laser or radiofrequency microneedling application.
Yeah, same with the face. They say once they've used them, their healing is so much quicker and they feel the results are better, and so do I. So they always want to keep doing it for that too.
So, but it not only makes, there's the other component that goes along with it. So it's not only making you heal faster, it also has the ability to make your treatment better, right?
Yeah. I mean, I think it's more anti-aging. It's more rejuvenating to deliver those growth factors through the pores that we create with the microneedling or the laser and deliver them to the dermis or the cells that we're looking for and get more results.
I want to just take a minute to promote, if you like, some of the gynecological procedures that we're doing that we refer to generally as rejuvenation.
Yeah.
The things that we can treat. There's a condition called genitourinary syndrome of menopause, which is a collection of symptoms that people can have some or all, or I suppose none, but it's all relating to the changes of estrogen in the postmenopausal patient and the deterioration of tissues. And what we are able to do, thanks to our plastic surgeons' forerunners on this, being able to use the same technologies in the vagina and the vulva, and in some cases for men as well, the penis, where we are starting that healing process and we're using all of these things. So we can be treating erectile dysfunction. We can treat anorgasmia, people having difficulty with sexual sensitivity, urinary incontinence, vaginal dryness, pain with intercourse. All of these things we can treat now that we haven't been able to until basically 8 years ago, when the first of these technologies was adapted from plastic surgery into gynecology, which is the Mona Lisa laser which is a fractional CO2 laser treatment. And my practice changed radically at that time. And that's, although my practice is still largely hormone replacement therapy, the adjunct is absolutely vaginal and pelvic rejuvenation. Prolapse, a whole bunch of different things that patients are suffering from. It's really, to me, it's just a really exciting time of medicine that we've got these new things. It's just not old people getting old. It's old people getting old, but doing very well.
Yeah.
So.
No, I think it's really exciting too. And I'm always for what's really safe that we can have people do. And just last week you did my under eyes.
Yes.
And I definitely see a difference. And you said I wouldn't see a difference, but I definitely see a difference.
Yeah.
Yeah. And I took my own before pictures too.
Good.
So
yeah, I mean the typical
with the Easy Gel.
With the Easy
Let's
Gel.
do an Easy Gel plug. So Easy Gel is, we're super excited about Easy Gel. So let's kind of talk about that a little bit, because I don't think anyone else in town has it.
Yeah, it's such a nice procedure, and we are turning your growth factors into a filler, and it's great. Under eyes particularly good because that's the thinnest skin on the body. It ages more rapidly, and we can really help regenerate the tissues there, regenerate the skin there, and help with the hyperpigmentation or the dark circles, and give a little volume. So under eyes was kind of the first big place, but we can use it throughout the face. You know, temple hollowing, I think it's a great spot for that. And it gives us enough syringes of it when we do it to be able to use it throughout the face. We can inject it throughout the skin just to regenerate the skin, or anywhere you would use a filler, you can definitely use it. The only difference is this we want to do in a series, really 2 that we do 4 to 6 weeks apart, and then a third session at 6 to 8 months for most people. And all these things require some maintenance. You know, it's hard to answer that question, how long does it last? Because it depends on lifestyle, sun exposure, et cetera. But anything we do, there is a maintenance, whether it's in 6 to 12 months,
Totally.
you know, just doing a little. We want to keep it up to keep those tissues regenerated.
It's all about maintenance as we get older.
Yeah.
We hear that from our patients all the time, like, oh my God. And picking the things, okay, what's important to me? Because I can't sustain everything. I can't maintain everything. So where do I really want to focus it?
Yeah.
And for a lot of women, it is honestly their vagina and their under eyes.
Their face.
So that's
things that are seen and things that are unseen.
I know. We should do some sort of combo special, actually. Rejuvenate the vagina and the under eyes. Actually, I'm going to work on that. So I know we talked a little bit about what you're excited about in the future, but let's revisit that to kind of wrap this up. What do you see in the future with regenerative medicine? Where do you think it's going? I mean, we had Dr. Dan on, he's a fertility doctor, and we asked him this question, and the answer was, I'm still thinking about his answer, how you're going to be able to put your order in for everything you want with your child and just get that embryo, right? It was something so crazy how our kids might be having kids one day.
Yeah.
Anyway, but I want to kind of take that question to you both. What do you see? Who wants to start? Let's look at 10 to 20 years away. What will our kids be doing?
Well,
as they age, what do you think is going to be? When do you think they'll start? Sorry, I keep interrupting.
No.
When do you think they'll start everything, and what do you think it's going to be?
Well, now, I mean, the biggest growing group, I believe I just read in aesthetics, is millennials and Gen Z. And they are prejuvenating. So we older people are rejuvenating what we let age, and they are prejuvenating. So they don't even want to age. They don't even want to have to undo this. So this preventative.
They're looking at us going, yeah, that's not going to happen
I'll never
to
look
me.
like that. And so, 20-year-olds doing, light Botox, starting skin treatments, certainly using these regenerative technologies, because once you're 25, your collagen does start declining, and they don't want to see that. So I think a younger patient population, I think they're going to start early, really using their bodies, and especially at that age too, the quality of your growth factors and your stem cells is actually a lot better than once we're 50, 60, et cetera. So using those regenerative technologies early to avoid, or not to avoid, but to slow down the aging process rather than undoing the aging process, which is kind of where we're at now. We're trying to backpedal a little bit, which is great. And I think it's for all ages. And but I think in the future, it's going to start just in the 20s, they're going to be thinking about slowing the aging process.
And you think exosomes will be mainstream?
I think so. I hope so. I think it just needs to be standardized. I mean, we certainly feel they're effective. So I think it's just because they're new technology, kind of working out the kinks of that. And then I think exosomes, in addition to
the
nanofat, stem cells, the PRP, PRF, I think those will really be the predominant things in the future.
Turner?
So I'd start a little earlier. I think the whole process of aging gracefully or aging at all has to be addressed from, somebody who's 25, 30 years of age, that they are doing things that are preventing the slowing down the aging process. And those we're looking at as things as basic as diet and exercise.
And sleep.
Diminishing stress. All of those types of things are going to slow that process down. But the body is still going to age to an extent, but if you can slow it down there, you're getting ahead of the game. Then you're getting into a point where there are hormonal changes as people get older, starting at basically 25, that testosterone levels for men start falling at that point. Estrogen levels will, for women, start dropping at around 40. But going back and sort of avoiding some of the problems, pregnancy and childbirth is hugely damaging to the human body. Yes, you want to do it, but there's a price to pay. And so any side effects that occur because of pregnancy need to be addressed. And that could be pelvic floor physical therapy. It could be any of the rejuvenation procedures that we're talking about, and improving the strength of the pelvic floor.
So that's starting earlier. That's starting earlier. All starting earlier. And then as somebody's approaching menopause, let's address it before it becomes a problem. So perimenopause.
Women
would be starting
premenopause, before menopause.
Okay.
Maybe 5 to 10 years before the average age of menopause is 51.
Right.
So by 40, people should be starting to pay attention to that. And you can't recover quite as quickly at 40 as you could at 20. So doing the exercise then is important, as an important part of that anti-aging process. And then when necessary, you use hormone replacement therapy. And I know that in a lot of people's eyes has a bad name, but in my opinion, and I'm not alone in this, is that it is safer to be on hormone replacement therapy than not for a lot of patients, for most patients, most women. And it's going to help the skin, it's going to help the bones, it's going to help the cardiovascular system.
Yeah.
And then when we get to the things that are needing real repair, then the things that we've talked about, the exosomes, stem cells, and treatments. And all of the same things, though: diet, exercise, rest, and good mental health are all part of that whole process. So start now.
Okay, one last question. Duncan and I watched this special the other night. It was on, I think it was just on regular network TV. Maybe you heard about it. Oprah was talking about AI.
Oh, I saw
Did you
that.
see
I didn't
that?
watch it. I saw it advertised.
It was really interesting. But what was said on there is AI, it's going to just be the biggest thing that's ever happened, right?
In medicine, I
In
think.
medicine
Yeah.
and in education.
Mm-hmm.
In education and in medicine. And that their look to the future, and this is not that far away. I think they said 10 years away, that there'll be, because of AI, that there'll be a 3-day work week.
I'm all for it. No, that's great.
Because AI will make your life, your job, what you're doing so much easier, that your real productive days that you will get done will be 3 days. And then you'll have 5 days to recover and work on everything that you guys just talked about, which being healthy, movement, having time to go to the market, cooking, eating well, exercising, all that stuff.
Yeah, I think there was another special with Bill Gates. I actually was watching it this morning, and they said the same thing, like a revolution in medicine and education. Yeah. The time that we spend, think of all the doctor's appointments too, you're running to, and when you can have access to that information, I think it's going to save time. It's going to really change the world. And we worry about the bad parts, but I think the good possibilities are really exciting. So, yeah. Future looks bright.
AI, absolutely.
Yeah. I'm using it so much. So I really like it. It's making my job easier. But we have to start using it in the office more.
Yeah.
For your notes, for your...
Oh, yeah.
Yeah.
That would be great.
Okay.
I agree.
All right, you guys.
Thanks.
Thank you.
Thank you. Thanks for having me again.
Well, thanks for listening. We're getting really good feedback. We'd really appreciate a review on Apple Podcast, Spotify, or wherever you're listening. Thank you. You can always DM the Vagina Doctor Instagram with any questions or topics you'd like to learn more about, or email us. The Vagina Doctor Podcast. It all starts here.